Dr. Grivita, you can start.
Good evening, everyone. On behalf, I, Dr. Grivita Raikar, co-chairperson, Women's Committee Maha-AP, is taking the pride to welcome you all for yet another interesting program in our monthly webinar, Wednesday Wisdom. This is one of the most awaited program of the month, and the topic for today is one of the most challenging topics in our routine office practice. So the theme for today is protect, promote and support breastfeeding. मराठीत सांगायचं गेलं तर आईचं दूध म्हणजे भूलोकातील अमृतच आहे. Breastfeeding is a gift of the mother not only to herself but also to her baby and the mother earth as well. So without wasting much time, I welcome our President, Maharashtra State IP, Dr. Ram Gopal Chejera sir, for his few words of wisdom.
Thanks, Dr. Grivita. Good evening, friends. Welcome you all. Another episode of Wednesday Wisdom. Now, as you know, our chairperson, co-chairpersons are always in the form. They take a lot of efforts for 1 month before presenting the topic to you. So, thanks, Dr. Manjusha and Dr. Grivita. And then when we decided, this time the topic was decided by Manjusha madam herself, and everything about the breastfeeding. So the first name came in our mind was our own EB, Dr. Jain Shah. He has done a lot of work in this field. So welcome, sir. And first time, I think in Maharashtra IP, we are having a gynecologist who is a lactational consultant. So we welcome Dr. Manglavani madam. She is the another expert. And for today's session, I welcome Dr. Prachi and Dr. Anju as our moderator. And today's presenters, I welcome Dr. Anuradha, Dr. Shabana, Dr. Kavish, Dr. Swapnil, and Dr. Surbi. I will not take much time. I'll just hand over to Dr. Grivita for further proceeding.
Thank you, sir. I also welcome Dr. Amol Pawar, sir, our Honorary Secretary General Maharashtra State IP. Is sir there?
No, ma'am.
I don't think so.
Okay. Since sir is not there, let's move further. Maybe because of some technical glitches, sir is not unable to join, but he would join soon. I welcome Dr. Manjusha Sherkar, ma'am, our dynamic chairperson who has been always supporting not only to me, but also to all our zonal EB members. Thank you for all your support, ma'am. Over to you.
Thank you. Thanks, Grivita, Dr. Prachi and Anju. Good evening, one and all. On behalf of Maha-AP Women Committee, I, Dr. Manjusha Sherkar, extend my hearty welcome and gratitude towards today's distinguished expert faculties, respected Dr. Manglavani ma'am and respected Dr. Jain Shah sir in our popular Wednesday Wisdom program. I welcome our beloved President, Dr. Ram Gopal Chejera sir, and our dynamic Honorary Secretary General, Central CIP EB, Dr. Amol Pawar sir, Central State IIP Office Bearers, Seniors, MMC Observers, and all the viewers who have joined from Zoom as well as YouTube. Friends, it gives us immense pleasure to get associated with many young dynamic speakers from all 5 zones of Maharashtra and Women Committee zonal coordinators being active each time in organizing this Wednesday Wisdom monthly program. Breastfeeding and lactation being the most innate actions expected to happen in every postnatal mother, but number of challenges are yet needed to be overcome by society and all the healthcare workers. The perfect mindset of ANC mothers, will protect, lactational guidance from lactational consultants will promote, and genuine support from the partner, family, and society will support breastfeeding in rising its incidence. Dr. Vani ma'am and Dr. Shah sir, being the national lactational consultants from BPNI Maharashtra, they are trying their level best to spread and protect breastfeeding all over India. So we all are privileged to have as expert faculties today. My hearty welcome to both of you, sir and ma'am. And my best wishes to each and every speaker, Dr. Anuradha Palwankar, Dr. Shabana Mujawar, Dr. Kavish Mehta, Dr. Swapnil Giri, and Dr. Surabhi Govardhan. Without wasting much time, I just give my best wishes and happy learning to everyone. Over you, Dr. Prachi. Thank you.
Yes, ma'am. Thank you, ma'am. Hello and good evening, everyone. Myself, Dr. Prachi Birari. We are extremely obliged to have two immensely talented faculties as our experts for today's session, Dr. Mangala Vani ma'am and Dr. Jayant Shah sir. It's my privilege and honor to introduce Mangala ma'am. Dr. Mangala Vani ma'am is a senior obstetrician, gynecologist, and lactation consultant practicing at Pune. She is the director at Hirkani Gynecology and Breastfeeding Medicine Clinic, Pune. Ma'am has held many dignified posts during her lifetime and always has made sure that her tenure becomes a remarkable one. Ma'am has received many prestigious awards like Young Scientist Award, Indian Achievers Award, Dhanvantari Award, and many more for her extraordinary work in the field of lactation. And our second expert for the program is Dr. Jayant Shah sir. I request my co-moderator, Dr. Anju Kadu ma'am, to please introduce sir. Over to you, Anju ma'am.
Good evening, all. And I take immense pride in introducing our another stalwart in this field of nutrition, Dr. Jayant Shah sir. He's a senior pediatrician and practicing for last 32 years in Nandurbar. He's a well-known international faculty for this nutrition and breastfeeding. International board certified lactation consultant since 2009. He has been recertified in 2014 and 2019. He's the chairperson and the past secretary of IYCF, the chapter of IAP, that is in 2024 and 25. He's the EB member of Maha IAP 2024. He's the past president of BPNI Maharashtra, IYCN faculty for BPNI Maharashtra, IYCF chapter of IAP. And he is the proud recipient of the Dr. N.B. Gupta Award for outstanding work in IYCN. He has been an author to many books, and he's had many accolades in many international conferences. And we are honored to have you, sir, as another expert. Thank you so much, sir, for accepting the invitation and to be an expert in this webinar. Thank you, sir. Over to Grivita. Over to Prachi, madam, please.
Dr. Prachi, unmute yourself.
Just to remind our delegates that MMC has granted one MMC point for today's program. So do not forget to write your names, IP registration number and MMC number in the chat box. Without wasting much of our time, we'll start with our today's session.
Dr. Prachi, just a word. We also welcome our MMC observer for today, Dr. Sanjay Gosavi, sir.
Yes, I was going to say that. And over to you, Anju ma'am.
Unmute.
Without much ado, we will get started with the first talk of
Dr.
the evening.
Anju, there is some issue with your audio. It's not clear.
We can't hear you, Dr. Anju ma'am. Prachi, will you take the first speaker then? Prachi, unmute yourself.
Yes, ma'am.
Yes, by that time, Anju ma'am will adjust her volume.
Yes, ma'am.
Yeah.
Our first speaker for today's session is Dr. Anuradha Palwankar from IAP Virar. And madam's topic for discussion is breastfeeding and immunity. Dr. Anuradha Palvankar, madam, is MBBS DCH. She has worked in Holy Family Hospital, NICU Bandra, Mumbai, and presently she is practicing in Abhinav Pediatric Hospital and NICU Virar, Mumbai. Over to you, Anuradha, ma'am.
Yes. Slides are seen.
They're not moving.
No. This doesn't look like first slide. Go to first.
शेअर स्क्रीन स्टॉप करून परत एकदा करा मॅडम.
Yes, ma'am. Yes.
That was PDF, not PowerPoint.
Yes. The slide is not moving. Just...
मॅम वरच्या कर्सरनी फक्त आपाप जा, तुमच्या पहिल्या स्लाइडला जा तुम्ही.
मॅडम जात नाहीये.
ओके, आय विल शेअर. जस्ट स्टॉप शेअरिंग.
ओके मॅडम.
थँक्यू.
Yes. So, good evening, everyone. Good evening, all the seniors, dignitaries, and delegates, and respected experts. I'm Dr. Anuradha Palvankar from IIP Palghar, and today's topic of discussion is breastfeeding benefits to diet. Next slide, please. So, first, we'll discuss the benefits for the baby. First and foremost importance is nutritional importance. Breast milk provides optimal nutrition to the babies. It has the right amount of nutrition and easily digestible. The stools formed by the breast milk are soft and liquid. It contains everything that babies needs for first 6 months of life. Its composition changes as according to the baby's needs and changing needs of the baby. That means the preterm babies get preterm milk from the mother, and full-term babies get full-term milk from the mother. Colostrum contains high proteins and low amount of sugar, which is important and needed during first few days of life. The amount of milk secretion increases as the baby's stomach grows. So this is a very important benefit to the baby. Next slide. This is second benefit is breastfeeding and immunity. Breast milk is the first vaccine to the baby created by nature, and it increases active and passive immunity of the child. This chart is showing the bioactive components present in the human milk. The first is soluble components, which contains proteins like antibodies, enzymes, and then hormones, growth factors, lipids, oligosaccharides, etc. In cellular components, it contains neutrophils, macrophages, and epithelial cells. And in microbiota, it contains lactobacillus, enterococcus, bifidobacterium, staphylococcus, and streptococcus, etc. Next slide, please. So these bioactive components fights against many bacteria and viruses, and also protozoa, and this protects the baby against acute and prolonged diarrhea. The risk of death from diarrhea can be reduced from 14 to 24 times in breastfed babies compared to the formula or other milk-fed babies. It also protects babies from necrotizing enterocolitis, mainly in preterm infants and asphyxiated infants. Then it prevents respiratory tract infections, including otitis media, urinary tract infections, and neonatal septicemia and meningitis. Next slide, please. So Let's discuss the importance of bioactive elements present in the milk. The first and foremost important is immunoglobulin, that is secretory IgA. It is present almost about 80 to 90% of all immunoglobulins, and others are IgM and IgG immunoglobulins. This prevents the entry of microorganism in the tissues and has anti-inflammatory properties. It binds with the pathogen and prevents penetration into the mucosa without initiating inflammatory reaction, which is harmful for the baby. So inflammatory reaction doesn't happen because of this activity of immunoglobulins with pathogen. Second is secretory component. It adheres to E. coli, Salmonella, and pneumococcus, and also fights with Clostridium difficile. Next slide, please. Then enzymes like lysozyme, lactoferrin, lactoperoxidase, they degrades the outer wall of gram-positive organism, directly kills gram-negative organisms, antiviral activity, direct cytotoxic effect on bacteria and all fungi. It has bacteriostatic activity and helps to reduce the immune response by blocking inflammatory cytokines. K-casein is having inhibitory activity on Campylobacter pylori. Haptocorin CD14 helps in development of gut immunity, and hormones and growth factor present in the breast milk helps in overall growth and development of the baby, and it also helps to secrete different hormones. Some hormones like prolactin and oxytocin is secreted in mother's milk. It acts on the breast tissue, which helps in the formation of milk. Next slide, please. So there are lipids which help in nutrition and development of the baby. Free fatty acids have anti-protozoal activity against Giardia and also antiviral properties. Nucleic acids increases iron absorption, increases bifidobacterium growth, and also it helps in development of GI mucosa and its repair. Oligosaccharides, carbohydrates, which promotes growth of microbiota, and it reduces the pathogenic bacterial load by reducing intestinal pH. And antioxidants present in the breast milk eliminates free radicals, decreases oxidative tissue damage to the tissues of the baby. Next slide, please. Last one is soluble component is cytokines and chemokines. These acts in prevention of allergies and hypersensitivity, and it increases thymocyte proliferation and also suppresses IgE production. Thus, it prevents asthma, skin allergies in children, which is most important benefit of breast milk to the babies. Cellular component present in bioactive components is neutrophils, macrophages, and epithelial cells. This directly kills organisms by phagocytosis, and it also helps in producing immunoglobulins. Microbiota is present in the breast milk, reduces the load of pathogenic bacteria, and thus prevents infection. Third most important benefit to the baby is thermoregulation. Right temperature of the milk prevents hypothermia in the baby. Then skin to skin contact while breastfeeding also prevents hypothermia. KMC in preterms helps in increasing the breast milk. Next slide. Fourth benefit is breast milk promotes baby's healthy weight. Breastfeeding prevents obesity in children. The microbiota present in breastfed baby's intestine affects the fat storage. And leptin is a key hormone present in breastfed babies that regulates appetite and fat storage, thus prevents obesity. Next benefit to the babies is breastfeeding makes smarter children. In first 2 to 3 years of life, brain growth is faster, and breastfeeding helps babies to have high IQ. Physical intimacy to mother, touch, and eye-to-eye contact increases cognitive development and memory of the baby. And nutrients present in the breast milk optimizes the synaptic connections of the brain in the newborns and children. The most pronounced effect of breastfeeding is seen in premature babies because neurodevelopmental disorders are more seen in preterm babies, and the effect is obvious in preterm babies. Next slide, please.
You need to be little faster, Dr. Anuradha. Your
Yes.
time is getting.
Yes, madam. Long-term benefits to the children are it prevents risk of autoimmune diseases, type 1, type 2 diabetes, rheumatoid arthritis, celiac disease, ulcerative colitis, and hypertension. It protects against childhood tumors like ALL, Hodgkin's, and neuroblastoma. Next slide, please. Benefits to mother are, first is it helps mother to lose weight. Breastfeeding burns more calories in the lactating mother compared to non-lactating mother. Breastfed babies have low risk of postpartum depression. The postpartum depression is more seen in women who weans early and do not breastfeed. Increase bond between mother and baby. Oxytocin is the hormone which is released during breastfeeding, helps in involution of uterus, also prevents postpartum hemorrhage. It is a love hormone. It is peaceful and nurturing hormone to the mother, which relaxes mother, helps to focus on the child, and creates strong sense of love and attachment towards baby, thus increases the bond between two and accelerates the growth of the baby. Next slide, please. It prevents breastfeeding, reduces the risk of breast cancer, ovarian cancer, high blood pressure, arthritis, type 2 diabetes. Continued breastfeeding prevents menstruation, lactational amenorrhea present in first few months of life, pauses ovulation and menstruation. Thus, it ensures the gap between two pregnancies. Next slide. It prevents the engorgement and abscess in the breast, and it saves time and money of the mother. By choosing breastfeeding, mother don't have to spend on formula, lactational consultant, and breast pump. She don't have to calculate how much baby drinks daily, spending time in sterilizing and cleaning the bottle, mixed and sterilized bottle in the middle of the night. So breastfeeding is free, at right temperature, sterile, and ready to drink. So key home message is breastfeeding is helpful to baby and mother, not only provides ideal nutrition to the baby, but also represents extraordinary immunological integration between both. And we can't discount the big benefits to mother for her health reasons and convenience. Thus, it benefits family, society, nation, and creates healthy and brighter youth. Thank you.
Thank you.
Thank you so much. With this, I would like to request our expert, Dr. Mangala Madam, to kindly highlight such important points on such an important topic. Over to you, ma'am.
Ma'am, unmute, please. Ma'am, unmute, please.
Can you hear me?
Yes, ma'am. Yes.
First of all, thank you so much, Maharashtra Academy of Pediatrics and Dr. Manjusha, Grivita, Amol Pawar, who has personally called me. Dr. Jayan Shah is a good friend of mine, and BPNI Maharashtra platform. We work together and meet very often. So I'm happy to see the breastfeeding has been given such an importance on this platform, and the juniors have asked to talk, so that then they also study further about the subject, which is very much ignored generally by the health professionals. So coming to Anuradha, very good presentation, very good efforts, sincerely made the slides, and we discussed things, and you nicely discussed about the benefits to the mother and to the baby. Now, when we talk to the patients, now you are not going to talk in such a detail to her. She's not interested. So the important topics that, because we have a less time in OPD. But yes, antenatal classes also, you cannot just discuss too much just on the small things. So increasing the baby's IQ, that is very important. की तुमची मुलं शाळेत जाऊन हुशार होणार, कॉलेजमध्ये अजून छान परफॉर्मन्स करणार, त्यांना पुढे जाऊन अजून छान जॉब मिळणार. मग कुठल्या आईला वाटणार नाही की आपल्या आईचंच दूध द्यावं, तर असे कन्व्हिन्सिंग काही काही स्टेटमेंट्स द्यायला पाहिजे. किंवा दुसरी गोष्ट की ह्या बाळाला, मराठी चालेल का, इंग्लिशमध्येच बोलू?
Oh, it's very fine, ma'am. Please.
तर ह्या बाळाला आत्ताच जेव्हा ते बेबी आहे त्याच स्टेजला नाही, तर पुढे जाऊन सुद्धा त्या बेबीला कितीतरी बेनिफिट्स आहेत. लाईक इट प्रिव्हेंट्स द हाय ब्लड प्रेशर, द हार्ट कार्डियक प्रॉब्लेम्स, ओबेसिटी. तर एक हिंदी पिक्चरमध्ये एक डायलॉग आहे, एक हिरो येतो आणि विलनला काय म्हणतो की माँ का दूध पिया है तो सामने आ. म्हणजे काय की ही इज स्ट्रॉंग, ही हॅड मदर्स मिल्क, so he is giving the challenge to the opponent, so it is that important. So when you are talking to the parents, I think you talk something interesting and they also get more motivated, and so generally it's good, Anuradha.
Thank you, madam.
Thank
so
you. Thank you. Unmute Anju ma'am.
Thank you so much, madam. It's quite an inciting insight into this important aspect
May I
of breastfeeding.
make a comment?
Yes, sir.
Yes, sir. Please, sir.
Yes, sir. Please,
I'll be
please.
very brief. Excellent presentation, and thank you all of you for this beautiful concept and inviting me for this. First of all, I just want to make one important statement is that the benefits of breastfeeding and breast milk are dose dependent. So you remember that it is not all or none phenomenon. Whatever breast milk is being given to the baby will have that much of benefit. So that is important. So any breastfeeding is much better than no breastfeeding. We know what the ideal is, but supposing ideal is not met, but any breastfeeding is much better than no breastfeeding. Secondly, the second important point which was made by Anuradha was the breast milk gives immunity without inflammation. This point is very important, because whenever you see immune reaction, you see the inflammation usually, and that inflammation causes damage. But here you get immunity without the damage. And third is, not only it does not cause uh, inflammation, but it has anti-inflammatory factors, that whatever inflammation is already caused, that is also reversed by breast milk. And important thing is IgA concentration is maximum in secretory IgA is maximum in the colostrum, and that too on the first day. First day colostrum IgA, serum IgA level is 10 times more, and the second day itself it starts down, getting down. And over the period, the concentration may go down of secretory IgA and some other immunity factors. But the thing is that the baby goes on consuming more and more of the milk. So although the concentration goes down, the baby gets equal amount of the immunity factors. So this is also important. And one important point about lactoferrin. Lactoferrin is, we all know it has many important factors like functions like immunity and anti-inflammatory factors, but also it is involved in iron transport. So it is important that you do not give unnecessary iron in first 6 months, because I have seen many prescriptions where routinely some babies are given without any specific reason iron supplementation in the first 6 months. So in exclusive breastfeeding, if it is not needed, and usually it is not needed except in certain situations, if you give extra iron, then the effects of lactoferrin are overwhelmed and the immunity benefits are lessened. Thank you.
Yeah, that is an excellent point. The dose dependent, and so we can also say longer the breastfeeding, more the benefits.
Yes.
Every each day, every month, and we say minimal 2 years of breastfeeding, but maximum as long as the mother and the baby wants. One more point, Anuradha, actually I forgot. You mentioned that breastfeeding prevents engorgement and breast abscess, and you also said no need for breast pumps and lactation consultant if mother is exclusively breastfeeding. But believe me, breastfeeding does have a lot of challenges, and they need proper supervision and proper guidance and hands-on skill, technical support to the mothers. So health professional has to have a proper training. At this junction, we don't have in the hospitals pediatrician and gynecologists, enough training. So the lactation consultant in such case, they play important role. So nowadays, I think that is the need of an hour. And it does not prevent engorgement provided the latching is right. There is an effective milk transfer. There is no maternal trauma to the nipple and the breast. Yeah. Thank you.
Thank you.
Thank you.
Thank you, sir.
Thank you. Thank you, ma'am and sir, for these important pearls. With this, with your permission, I would like to invite our second speaker, Dr. Shabana Mujawar. She's from IIP Sangli. She'll be talking on challenges in breastfeeding from the first golden hour. Over to you, Shabana, ma'am.
Good evening, everyone. Am I audible?
Yes.
Yes, ma'am, you are audible.
The
Yeah.
screen.
A very good
Yes.
evening, all of you. Myself, Dr. Shabana Riaz Mujawar. I am a Secretary Women's Wing IIP Sangli District Branch. I am here before you to present the challenges in breastfeeding in the first golden hour. Now, what is the first golden hour? The hour immediately after the birth, irrespective of the mode of birth, that is normal or cesarean, is called the first golden hour. Now our mother nature is very much kind to all the mammals, so all human babies and the mammal babies are capable of actively seeking their mother's breast and immediately start nursing after the birth. Now, when a newborn is placed on its tummy on the mother's stomach, it crawls up towards the breast, finds them, and start nursing, which is called the classic breast crawl. Now, all babies are alert immediately after the birth and are able of doing the crawl immediately after birth. As we have already seen the benefits of breastfeeding by Dr. Anuradha, in the first golden hour, the benefits for the baby are reduced hypothermia and hypoglycemia due to the skin to skin contact being present, stabilization of all the vitals, blood pressure, respiratory rate. It decreases the stress hormone, and most importantly, it increases the bonding with the mother. I want to emphasize that this bonding, which is done in the golden hour, will help in the sustenance of the exclusive breastfeeding, which is the recommendation by the WHO. The importance for the mother, as discussed before, reduces the incidence of PPH, that is postpartum hemorrhage, and leads to faster uterine involution. It also increases the maternal satisfaction and decreases the anxiety. And this helps in the confidence of the parents, which will lead to successful breastfeeding in the initial golden hour. Now here we will see the challenges in the breastfeeding. So I have divided these challenges into three parts: the medical intervention barriers, the physical and emotional barriers, and the last is the environmental barriers. Now let's see the medical interventional barriers. As we all of know that there is increased incidence of cesarean section deliveries in this recent era. And this is the most important barrier for the initial breastfeeding in the golden hour. Now, second is the prolonged anesthesia. Many a times there are medical complications in the mother which require anesthesia, and the baby and the mother is in a drowsy or a sedative state, and which interrupts in the initial breastfeeding for the first hour. Then there can be the medical emergencies in the baby also, like if the baby doesn't cry after birth, or during the routine newborn resuscitation of the baby. Like even if the baby cries immediately after the birth, the baby is normal by vitals, still there is the procedure of post delivery resuscitation, like baby warming, weighing and tagging of the baby, and giving vitamin K injection. And these all routine procedures is the most important barrier in the initial nursing. Then comes the physical and emotional barriers. Most importantly, the mother is undergoing extreme pain and is almost exhausted after either the normal delivery or after the cesarean section also. So this could be the major barrier from the mother's point of view. Also, there is anxiety, especially in the gravida mother, or there can be a lack of confidence in the breastfeeding, which is another barrier from the mother's side. And as I already told, there can be medical complications in the mother, due to which mother is not in the position, not in a vital state to feed her baby. For example, postpartum hemorrhage or pregnancy induced hypertension. Similarly, there can be medical complications in the baby, where the baby is not in a state of feeding directly from the breast. For example, most common we are facing is birth asphyxia, or if the baby is born preterm, then the chances of initial breastfeeding in the first golden hour is difficult. Then comes the environmental barriers. Now I have divided these barriers into two, that is internal barriers and external barriers. So let us see the internal barriers, which I want to emphasize this slide more. Now, internal barriers means related to the internal environment of the delivery room. The most important thing is reluctancy about change in the standard operating procedures by the staff including the nursing, the doctors, and everyone who is there in the delivery room. So they are so much used to the standard operating procedures that they want to just finish the things and go off. So the change in this standard operating procedures is very difficult. Now we also there is a difficulty in stopping long standing practices like immediate cord clamping and early bathing of the baby, which is practiced since ages. So it is very difficult to stop these practices even after repeated instructions. And the other thing what we all feel is that the baby is safe in the warmer. So this perception is extremely wrong. So if the baby is kept in the warmer and not been given the initial breastfeed, it is harmful for him. And the hurry in checking the weight, tagging, taking footprints, vitamin K by the staff, the nursing staff, is also causing the most important internal barrier. And the thing is, there is absent knowledge of this golden hour in the staff and both the family members also. So they don't know the importance of the initial breastfeeding in the first golden hour. Now, external barriers from the mother's point of view, if we see, there may be privacy concerns to the mother. So in the delivery room, if you ask her to feed in front of all the personals, the nursing staff or the anesthesia personals, there can be privacy concerns to her. And the family members who are very eager to hold the baby, so they interrupt in the initial feeding in the first golden hour. There can be interruptions by the staff, as I already mentioned before, because they just want to get the things done as early as possible. And the next thing is the cultural practices in the family. For example, in the Muslim religion, they do azan in the newborn's ears. So before that, they don't want the baby to feed. So these cultural practices make unnecessary delay in the initial breastfeeding in the golden hour. Now, how to address these challenges? So we can address these challenges right from the antenatal period. So the
Shabana ma'am, sorry to interrupt you, ma'am. 8.5 minutes are done already.
Yes, madam. So in the antenatal period itself, we have to start educating the mothers, and you also have to train the husband and the family member for the importance of the golden hour. During delivery, you have to educate and train the healthcare providers, because here in the healthcare providers, we have absent knowledge of golden hour. So educate and have them deliver it through the right skills, and either allow a trained person, that's either a husband or family member, to be alongside the mother. You can see in the picture, the husband is helping the mother to have a start the initial breastfeeding. Ensure a quiet private space for the mother and baby, and delay all the non-urgent procedures for the baby. And as madam already said, there should be provision of lactational consultant support immediately after birth. And you have to use all the available resources. For example, if the baby is delivered by the cesarean section, the picture shows how the nurse is the baby is being fed from the shoulder support. So the anesthesia people present in the operating room can also help in this venture. The Jipmer hospital has started the bonding angel program, where each mother is assigned a nursing student to help assist the baby in the initial golden hour. Now, in some cases where the mother and baby are separate, in that case, you have to use the express breast milk, especially in the NICU babies, but don't delay the golden hour. And avoidance of prelactal feeds should be present to avoid the initial harm to the babies. Now, conclusion final for this presentation is the first golden hour is critical for successful breastfeeding. Various challenges exist, but with proper support, many can be overcome. The most important thing here is the healthcare providers and families play a key role in facilitating early breastfeeding. So we need to educate, train, and provide good skills for early breastfeeding. Thank you so much.
Yes, thank you.
Thank you,
Yes.
Shabana ma'am, for such golden words on golden hour. With this, I would request Mangala ma'am to make a few comments. Over to Mangala madam.
Ma'am, unmute, please.
Yes, Dr. Shabana, it was a good presentation. You
Thank
have
you.
to make sure that the time slot that given to you always, you have to think about the time of everybody, and you have to give the similar, chance for the other speakers also. So
Yes, madam.
always make a practice and shorten, and just deliver the important messages. In the future also, when you are talking on the bigger platforms, on the national platforms, actually you should finish 1 or 2 minutes before the time given to you. Very, very, very important. And now thinking that your presentation and the barriers for the golden hour. Golden hours means some of the latecomers may not knowing that the World Health Organization has recommended to initiate the skin to skin contact within few minutes after birth, so that the baby initiates the breastfeeding within 1 hour after birth. Now, Shabana has nicely explained there are so many benefits, and it looks so simple. The baby is born and the baby just put to the breast, and that's it. But it doesn't happen. If you see the Indian figures, only the 2 babies in 5 babies they get the initiation within 1 hour, and so we have a long way to go. And just changing the little attitude of the relatives, the antenatal classes, so that the mother knows importance, with the mother, the family as well. And of course the education, the skill, the knowledge of the staff, again most important, the policy makers. That is why now Manjusha madam has done our IBCSE course. So like that, if so many seniors also enroll and just learn, there is always something new to learn at any age. There is no age bar. So then you can change the practices of the hospital, and surely the initiation rate can go high. Thank you, Shabana.
Yes.
Thank you, madam.
Dr. Jain sir, you want to say?
Yes, a few words. A good presentation, Dr. Shabana and Mangala madam. Thank you so much. आणि
Thank you.
यात एक दोन पॉइंट्स असं सांगायचं आहे की golden hour, we all have understood the importance of golden hour, but the main barrier that comes is ourselves, our colleagues, because so often I see that on the very first prescription, immediately after birth, the pediatrician or the neonatologist writes that heart rate is so and so, cried well, etc., etc., and the first prescription is some formula. I fail to understand how can it be. जो शेवटचा पर्याय असू शकतो तो पहिला पर्याय म्हणून कसं काय वापरू शकता. So and whenever we discuss with them, they said that there was no milk. I tell them की समजा एक जण आहे, एक मुलगा आहे, त्याला आपण आज गणित शिकवलं आणि पहिल्याच दिवशी तुम्ही कसं म्हणू शकता की याला गणित येतच नाही. तुम्ही थोडे दिवस त्याला प्रॅक्टिस द्या, थोडं शिकवा, पुढे करा, मग काही दिवस झाल्यावर तुम्ही म्हणू शकतात की याला गणित येत नाही ना. तर हाऊ डू यू नो दॅट देयर इज नो मिल्क ऑन द व्हेरी फर्स्ट डे ऑर व्हेरी फर्स्ट मिनिट? तर हे एक महत्वाचं आहे. आणि सेकंडली इज many of them are afraid that if you don't give formula, the baby will develop neonatal hypoglycemia. And because of this fear, they say that it is safe to give formula. But again, there is a big topic of neonatal hypoglycemia and breastfeeding. But for normal babies, normal mother, and for every normal thing, this thing usually does not happen. You have to monitor every baby clinically, but there is no need to monitor by blood glucose level of every baby. You have to monitor blood glucose level of high risk babies, but every baby has to be monitored clinically. And if there are any chances or any signs that are developing, then of course you have to intervene. And one more thing about breast crawl. Whenever this breast crawl occurs, there are about 17 to 19 hormones are involved in this whole process. And one important hormone that we all know is oxytocin. So oxytocin is secreted not only in mother, but it is also secreted in baby's brain. Oxytocin has two types of circuits. One is throughout the body when it goes into the blood, and it has effect on the uterus as well as on the myoepithelial cells. That is one. But there is internal circuit in the brain itself, and that is important for the what we call as love hormone. So, and it is also secreted in the baby. So that is why these are two important points I wanted to make. And uh, uh, early initiation breast crawl will help not only in the immediate success of breastfeeding and lactation establishment, but it is also known that if the breastfeeding started early, the breastfeeding continues for a longer period. So it can continue up to 2 years. The mother will have better milk supply. Thank you.
Ma'am,
Thank you, sir.
support of gynecologist also is more important, I think. They only force many times. I'm so happy that Mangla Vavni ma'am being a gynecologist, she's present here. So your spread a word in OBGY society is more important, ma'am.
Now actually in the our next meeting on the 25th, they have given me the talk, the role of obstetrician and gynecologist in promotion of breastfeeding. So it is all health professional whoever comes contact with mother and the baby. But the gynecologist, they are seeing the mother for 9 months.
That's right.
They have developed the rapport, the mother and the doctor, the gynecologist. So she readily listens to the gynecologist. Pediatrician is a very newcomer that time, and they are very busy. So the mother, the latching, even her any breastfeeding issues like nipple trauma, she can discuss more openly to the gynecologist. So they should be aware of all this, the initiation, then about the latching. Even seniors, even if they don't have sitting with the diet, when they are doing the round, they can see whether the formula dibba is sitting in the corner. What has happened is the exclusive breastfeeding is been given, and the many times the junior nurse comes, and she's assisting. Means to my patients, I know whenever I go for round, I see they just hold the nipple and force in the baby's mouth. The baby's not opening the mouth. All the wrong things are happening, and my heart really sing all that. So my case is like that. So what about the other gynecologists? So their training is also very, very extremely important. It is a teamwork.
Ma'am, just a small suggestion. Like in the maternity homes where I am attached, what we do is every month we take antenatal programs online where the mothers, pregnant mothers,
Yeah.
and the
Yes.
gynecologist as well as the pediatrician, we speak about breastfeeding. So the pediatrician is involved right from the very beginning, and this helps in building up that rapport with the parents
That's
in
a
the
good
very
idea.
beginning.
Excellent.
Chalo. Thank you, everyone. Thank you, sir
Thank
and
you.
ma'am.
Thank you
Yes.
so
you,
much,
madam.
madam. With this, I would like to hand over the further proceeding to Dr. Prachi.
Thank you, Anju ma'am. Next topic of our discussion is technique or the latch for a successful breastfeeding. And I invite a neonatologist, eminent speaker from Nasik, Dr. Kavish Mehta. Mehta sir, over to you.
Thank you, Prachi ma'am. Myself, Dr. Kavish Mehta. I'm speaking on technique latch of a successful breastfeeding. Breastfeeding is a natural and beneficial way to nourish and bond with your baby. Technique and latch are key factors in ensuring successful breastfeeding. This presentation will cover important techniques and latching methods for successful breastfeeding. So what is the importance of correct technique? Proper breastfeeding technique ensures adequate milk supply. It helps the baby have a comfortable and efficient feeding experience. Correct technique ensures that the baby gets enough milk and gains weight appropriately. How is the latching technique? Hold the baby close to the breast with baby's nose aligned with the nipple. Wait for the baby to open mouth wide. Bring the baby near breast, aiming their lower lip far from the base of the nipple. The baby's mouth should cover most of the areola, ensuring a deep latch. So as you see with these two pictures, you can make out that in picture one, the attachment is very good. In the second picture, you can see it is a shallow latch, which says that it is a poor attachment. Sign of a good latch is the baby's lips should be flanked outward, not turned inward, and baby's mouth covers a large portion of the areola, not just the nipple. The baby's cheeks should be rounded and not dimpled. Baby should be able to suck and swallow rhythmically with audible swallowing sounds. So this is a latch score which was published in 94. Nowadays it is not used much, but it's a wonderful scoring system which can be taught to the sisters or the paramedical staff who is taking care in the postnatal ward. It includes 5 components like the latch, audible swallowing, type of nipple, comfort, hold and help, that is a positioning. And accordingly, it helps the mother to understand where she is and what she needs to do for the good latch. The most important part of the technique is maternal position. Mother should have a good back support, elbow support with lots of pillows, knee level with hips when sitting. She should be relaxed. Front open clothes is necessary to have a skin to skin contact, and holding of the breast C-shaped is necessary, and bringing baby to the breast instead of breast to the baby. So these are the type of holds: C hold, U hold, and the V hold. And the technique, as we discussed earlier, mother touches the nipple to upper lip, and as soon as the baby opens the mouth widely, she brings baby to the breast. Positioning of the baby, there are some few positions which I'll be discussing, like the cradle hold, football hold, side lying position, and boppy pillow or breastfeeding pillows can provide extra support. So in cradle hold, baby lies on their side with their head in the crook of the mother's arm. In football, baby is supported by the mother's arm, positioned beside the mother. In side lying position, both mother and baby lie on their sides, facing each other. For a single baby, these are the methods: cradle, cross cradle, football, side lying, and lit back. For multiple babies like twins or triplets, there's a double football method, football and cradle method, front cross and upright latch. This is a pictorial presentation of cradle hold or Madonna position. On the right side, you can see cross cradle hold, in which the other hand it crosses and the cradle hold is done. On the left side, you can see the football hold, and the right side is a side lying position. In twins, these are the methods: front cross, double football, football and cradle position, and the upright latch. In this picture, you can see twins with front cross position. In the right picture, you can see the cradle position along with the upright position. So techniques for a better latch: gently stroke the baby's cheek or chin to encourage a wide mouth opening. Nipple stimulation or expressing a little milk before latching can help withdraw out the nipple. Use finger to break the baby's suction before unlatching, and experiment with different latching techniques to find what works best for mother and baby. Common latching issues which we face are shallow latch, baby only latches onto the nipple, causing pain and inadequate milk transfer. Tongue tie, short or tight lingual frenulum, restricts the baby's tongue movement, affecting the latch. Flat or inverted nipples reduce stimulation and difficulty for the baby to latch. So to conclude, technique and latch are vital for successful breastfeeding. Positioning the baby correctly and achieving a deep latch are key components. Seek assistance from a lactation consultant or healthcare professional if mother encounters any difficulties. Remember, breastfeeding is a learned skill, and practice and patience are essential for success. Thank you.
Thank you. Thank you, Mehta sir, for such crisp presentation. I request Dr. Mangala ma'am to share her valuable comments. Mangala ma'am.
Ma'am, are you there?
Jayant sir, I request you to please share your valuable comments.
मी मंगलवाणी मॅडमांना फोन करतो. जयंत सरांचे कमेंट्स घ्या आधी.
हो सर.
So nice presentation, Dr. Kavish. A few points. Practically आपण जेव्हा बघतो बऱ्याचदा मदर्सना अशी ऍडवाइस मिळते, त्यांच्या घरून मिळते, कधी सिस्टर्स कडून मिळते, कधी डॉक्टर्स कडून मिळते की तुम्ही बसूनच पाजलं पाहिजे. This is not true. Every mother must learn to feed in various positions आणि रात्रीच्या वेळेला आडवं झोपून पाजता यायलाच पाहिजे. Otherwise, every few hours she has to sit down and feed, and she will also need to burp, and after all these things she will not have proper sleep, and she will start getting backache and other problems. So every mother must learn to feed in the lying down position also. And I find that the most easy position is laid back position, which is almost never used. So laid back position, टेका लावून झोपायचं, बाळाला वरून ब्रेस्टफोर्ड सारखं टाकायचं. दॅट इज अ व्हेरी सिम्पल थिंग. एवढंच बघायचं आहे की बाळ आपल्या अंगावरून खाली पडणार नाही. बेबी ऑटोमॅटिकली फीड्स लाईक दिस अँड द लॅच इज परफेक्ट बिकॉज इट इज उलटा. सो दिस इज व्हेरी सिम्पल. ते तसं करता करता बेबी असं डोकं वर करतं, आई बरोबर आय टू आय कॉन्टॅक्ट करतं. दॅट इज अ फॅन्टॅस्टिक साईट फॉर ऑनलुकर्स ऑल्सो अँड फॉर द मदर ऑल्सो. So this is one point. Then cross cradle hold and cradle hold. Cross cradle hold is more important in the earlier ages when the baby is small, and also for the slightly weaker babies. So in those you prefer this kind of cross cradle. And when the baby grows a little older and is established breastfeeding, then you can have any, whether it is cradle hold, football hold, or whatever. So cross cradle in the initial phase, it is very good because it is shown that it gives better milk transfer and better weight gain also. You said in the end that practice and patience are important, but at the same time support is also equally important from the family members, from the healthcare providers, and the society as such. And one additional point I would like to tell everybody, that whenever you are downloading any images from internet, see that they are not they are not bound by copyright. Because if you present outside and it is a bound by copyright, it can be a criminal thing. So you have to see whether it is free, and if you want something from the internet which has a copyright, you have to write to them and get the written permission. These are the things I wanted to say. Thank you. But otherwise, a good presentation.
Thank you, sir, for your valuable inputs. I request Mangala ma'am to share her expert comments.
Pallavi ma'am, can you unmute ma'am?
Already done, ma'am. Already done.
Yeah, okay.
Ma'am,
Thank you.
kindly try to unmute yourself. Mangala ma'am. Mangala ma'am.
Ma'am, please unmute yourself.
Yeah, now can you hear me now?
Yes,
Yeah,
yes, ma'am.
yes, ma'am.
Okay.
Yes.
सॉरी माझ खरंच माझ्या लॅपटॉपचे दोन्ही लॅपटॉपचे प्रॉब्लेम्स आहेत येस सो दॅट वॉज क्वाईट गुड प्रेझेंटेशन वेन एव्हर लॅचिंग यु नो वी स्पीक वी हॅव टू हॅव दिस लिटल वन यु नो से हॅलो टू एव्हरीबडी
Hello. So nice.
show the positions properly. So what the 4 or 5 positions, and as Jayan sir say, I was just halfway, I have missed the point. But in the beginning, the cross cradle is very important. So when the mother is breastfeeding from the left side, she holds the baby with the right hand and supporting the bottom. Then she supports the neck of the baby. And we always say ki never press the baby's head. Yeah, support the neck. Because whenever the breastfeeding, like when we are drinking the water, our neck is extended. We cannot drink when we are like this. So similarly, if the head is pressed, the baby's neck becomes flexed. And the baby cannot latch. So baby tries to get away because the nose also gets into the breast, and then everything gets haywire and the latching becomes shallow. So here, so automatically the neck is extended and then the chin touching the breast. But these are the very important. And in the beginning, cross cradle is always important because both mother and the baby are learning, and then the support of the neck doesn't become unstable, so that then the baby latches. Once they learn, then any position is fine. Because what happens in the just cradle hold, the baby's latch is deep in the beginning, it doesn't happen. So it's very important we tell the mother the cross cradle in the beginning. So all those positions, to learn, even like when me as a gynecologist to learn the cesarean section, it takes 6 months, 1 year as a resident. And similarly, when I got interest into the lactation and breastfeeding, and I started going to the lactation clinic to learn, and believe me as a gynecologist having 2 children of my own, still I found difficulty helping the mother with the breastfeeding. Good 6 months I was going regularly, and then I became confident. Yes, I can now help mom. So similarly, the health professionals also need a help. Now listening, there are more than 200 participants, delegates listening. So it is very important. You have the knowledge, but you have to learn the skills also. So your maternity homes, make sure they give you, very regular training, or you go for these different training programs, or you can become specialized in breastfeeding as well, because that becomes additional feather for you, particularly you as a pediatrician or a gynecologist. Thank you.
That's
Thank
great,
you.
ma'am. Thank you for the demo also. Thank you, ma'am.
Thank you, ma'am. Thank you, sir. Coming to the topic, very important in today's era, breastfeeding and work balance. To address it, we have Dr. Swapnil Giri as a speaker from IIP Hingoli. Swapnil sir, over to you.
Yeah. Good evening, all seniors, moderators, teachers, and my colleague. Can
Can you
see the
hold your
slides?
mobile panoramic view, Dr. Swapnil?
Yes. Yes. Is it visible, ma'am? No?
Yes, yes, yes.
Yeah. So coming to the today's topic, it's a short but a very important topic in today's era. Like as Prachi madam said, breastfeeding and work balance. This because the most of the women now are working nowadays. And my previous all speaker have mentioned the benefits of breastfeeding already. So in short, breastfeeding gives children a healthier start in life. Breast milk act as a baby's first vaccine. It stimulates brain development and protects a woman's health. Work and family can be difficult to balance at the best of times, even normally also. And for breastfeeding mothers returning to work after giving birth, it can easily feel overwhelming. Breastfeeding is one of the best investments society can make in children and women's health survival. The cost of breastfeeding is enormous. Cost of not breastfeeding is enormous, impacting individuals, families, and community. The concept of nowadays concept of both parenting sharing responsibility for domestic care work, including breastfeeding, is gaining momentum and should be supported at society level. As previously, only woman, mother used to involve in breastfeeding. So, one of the most common reasons that breastfeeding is curtailed earlier than is necessity is women to return to work or lack of support they receive at workplace. As studies have proven that longer maternity leave is associated with lower infant mortality rates in lower and middle income countries. So, establishing and maintaining breastfeeding requires that all working mothers should have at least 18 weeks or preferably 6 months or more of paid maternity leaves and at least 15 days or more paternity for father so that he can support the breastfeeding diet. Both parents need information on advantage and management of breastfeeding on their entitlement to the maternity, paternity, and paternal leaves. So for breastfeeding at work, there are some points that mother can plan earlier. So they have to keep their babies with them and breastfeeding throughout the day. If workplace is nearby, go home during the day and breastfeed and or have someone from the home to bring the baby to them at workplace. If workplace is further away, use a daycare center nearby where they can go during the break and breastfeed the child and come back to work. And if breastfeeding during work hours is not at all possible, learn to express their milk and have somebody to a caregiver to give milk to their baby at home. At workplace, there should be provision of hygienic breastfeeding rooms, breastfeeding milk storage facilities, breastfeeding breaks, and access to the childcare. So, this coming to these four titles: breastfeeding rooms and breastfeeding breaks. The provision of breastfeeding rooms and breastfeeding breaks are low-cost intervention that can become a part of family-friendly policies with several benefits for the workplace. Becoming the breastfeeding friendly workplace can reduce the employees absenteeism and increase employees return to work rates, job satisfaction and retention. And this in future results in increased productivity, competitive age and cost saving associated with the healthier workplace, and breastfeeding rates can also improve. If breastfeeding is not possible at workplace, then expressing breast milk is a very important thing. The express the milk as often you would feed your baby and store the breast milk in the sealed container. Keep the containers inside the refrigerator or insulated coolers. Do not put breast milk in the door of refrigerator where temperature is not stable. So because each time the door is open, the temperature can rise and it may increase the risk of bacterial contamination in the breast milk. Transportation of the breast milk at home. So breast milk can be transported by some home member in an insulated cooler. If there is no refrigerator at home, the breast milk can be directly given to baby about 4 to 6 hours at room temperature, depending on the temperature. And then freshly milk uh, should be consumed by baby as earliest. Or if it has to be stored, it can be stored into a refrigerator at the back of the refrigerator for 24 hours, where the temperature is mostly constant. And breastfeeding should be given directly whenever possible. Expressing breast milk in the workplace directly breastfeeding your child whenever possible will help you continuing the making milk. If breastfeeding is not given regularly, breast milk is not removed regularly from breast, it may lead to the plug ducts, mastitis, and in future it may decrease the breast milk supply. So before going to work and after coming home, the breast milk should be given as early as possible to the baby, and instruction should be given to the caregiver that not to breastfeed the baby 1 hour before, 1 to 2 hours before you are reaching home. Otherwise, your baby may be full and she may not be wanting the milk right away. So as much as possible, try not to skip the direct breastfeeding at night, as these things help to sustain the milk production. So key points: support system should be created. Inform the employers and colleague beforehand that you wish to continue the breastfeeding at joining work after joining the work. And if there are other colleagues who are breastfeeding mothers, then they can form a group of breastfeeding mother, and then they can support each other in a workplace, at the workplace. Discuss with the employees about the flexibility of your work hours and the private area for breastfeeding or expressing. And most important topic, that do not neglect your health. The rest, adequate rest should be there, proper nutrition should be there, and breastfeeding and work need to be balanced. India has good policies and laws, and however, there is implementation is unsatisfactory. There are in Maharashtra, there are places like Hirkani Kaksha at all the public places like hospitals, bus stands, and all railway stations. So they should be utilized for breastfeeding your baby. Thank you all. Thank you.
Thank you. Thank you, Swapnil sir, for such an informative talk. I request Jayant sir to please share his expert comments. Jayant sir.
Thank you. Well presented, Dr. Swapnil. Most of the points are well covered. One important thing is every mother, before she is discharged from the hospital, must learn to express the milk. We never know when she will need that. So every mother must learn to express before she is discharged from the hospital after giving birth to the baby. This is one important point. Then Hirkani Kaksha, as we said, for the breastfeeding rooms, that is a tribute to Hirkani. We all know her story. One important thing is, although Swapnil sir has said about it, but breastfeeding and breast milk feeding are not the same. There is a difference in both of them, and breastfeeding directly has more benefits than breast milk feeding. So as far as possible, we have to see that direct breastfeeding is the first thing that is tried. If it is not possible, then mother's own milk, which is expressed and then given to the baby, and after that all the other options will come. So when the mother is going to the work, so beforehand, say from the last night itself, she can express a little bit in the containers and put it in the fridge, and in different containers she can put from left to right. She can put it should not be in the freezer, it should not be in the door of the refrigerator, and it should be, say, in the just below the chiller, from in the depth. And whenever the same milk is being used by the caregiver when to feed the baby, the first in first out, the first container or the first vati that goes in will come out first. And it is very cold. If it is not very cold, it is not very important to heat it. And whenever it is very cold, again, you'd never heat it directly, you'd never put it in the microwave also. The best thing is to take a water bath, take a bigger utensil, take a hot water, and put the katori halfway inside and just shake it around, so that it comes to the temperature, and then feed. So first in first out. And again, the important thing is, India has a maternity leave. 6 months maternity leave is sanctioned. Two of the states have sanctioned 12 months maternity leave, and we are working as IYCF chapter to discuss with the government to increase the maternity leave from 6 months at least to whatever we can. Thank you. And the most important point, as Swapnil said, the implementation is not right.
So just to add on this, may you please share with us the number of hours which the mother could store the milk at room air, in the refrigerator, in the deep freezer? How long could that, just for the
Yes, at the room temperature also, if it is not too hot, you can store for 4 to 6 hours. It will depend upon the how carefully you have stored. If there is a risk of contamination, the storage time will decrease. If it is too hot, then again the storage time will decrease. If it is good winter, then it might last a little longer. In the refrigerator, as I said, at that point you can keep about 24 hours. And in deep freezer, whenever it is kept, for example, in human milk banks, etc., you can have it for even up to 6 months.
Yeah. Thank you, sir.
Mangla ma'am wants to add. Ma'am is not there, I think. Vani ma'am is there? Acha, okay. Just invite fifth speaker, Prachi.
Yes, ma'am. Let's move on to our next topic of discussion, legal rights and protection of breastfeeding. Our next speaker is Dr. Surbhi Govardhan from IAP Nagpur. Dr. Surbhi, over to you.
Yeah. Thank you, Dr. Prachi, and I'm so glad to present in front of all the teachers I've learned from. A very a near to good night to all of you. I'll quickly share my screen because we are already late on the sessions. So just let me know if my screen is visible. Yeah, Dr. Prachi, is it visible to everybody?
Yeah.
Yes, it's visible.
Thank you so much. So my topic for this webinar today is legal rights and protection of breastfeeding. So hi everyone, I'm Dr. Surabhi Govardhan from Nagpur. I'm a pediatrician and I'm passionately working in lactation counseling and infant and young child nutrition. So thank you for this topic. Why do we need to protect breastfeeding? So if all of us have gone through these data somewhere through our practice, I would just like to highlight these few pointers that the rates of early initiation of breastfeeding is around 46% according to these recent data. And the rates of exclusive breastfeeding are just 73%. There are many dropouts of breastfeeding, although I don't know the exact statistics, but we have seen in practice that within 3 months of birth, because of many challenges, the mother is unable to continue it up to 6 months. So there is also one study which mentions that around 22% of neonatal mortality can be prevented. Sorry for that. Can be prevented with early initiation of breastfeeding. And we still have a lot of undernutrition, malnutrition under 5 years of age, where underweight children are up to 18% and stunted children are up to 30%. So these are the pointers which make us realize that how we need to protect breastfeeding. And when we talk about protecting breastfeeding, we should also know about the legal rights of a mother who has now delivered and is about to breastfeed her child. So these are the 3 important acts which all of us should be aware of: the Maternity Benefit Act, IMS Act, and the Paternity Benefit. So I'll quickly take you through these 3 acts with some important pointers for all the healthcare professionals who are attending the meeting today. And it should be propagated amongst us first. So we should be knowing the important pointers. As Dr. Jayant already mentioned about 6 months of maternity leave, which is being given to many government and private sectors. This is a very important change that was made in the year 2017, where earlier it was up to 4 months, but then it is now up to 6.5 months of for working women with less than 2 surviving children. There are provisions in this act for working from home for nursing mothers. As from the COVID era, we've noticed that many of the private companies have given work from home as an important factor for many working mothers. So the nursing mothers also receive this benefit. There are mandatory provisions for establishment of creche in an establishment where there are 50 or more employees working. And the extension of 12 weeks of maternity benefit to the commissioning mother. So we need to, this term may be new for many of us, but we need to understand that a commissioning mother is an intending mother of a child born through surrogacy. So there are many working mothers who are opting this way of bearing children, and even the adopting mother is entitled to receive this much of leave from the date the child is handed over to the mother, and of course born to the mother who was a surrogate. So provision of the Amendment Act have come into force from the year 2017, 1st April. There were some pointers which I found that should be known to us, because these might be the potential questions that we may receive when we are talking about the Act. So just go through this. I'll quickly make it a run through. Applicability of Act is applicable to all the contractual or consultant women employees. And there are no such amendments in this Act for these 2 categories. Whether enhanced maternity benefit by the Maternity Benefit Amendment Bill can be extended to women who are already under maternity leave at the time of enforcement. So yes, it can be availed by these mothers also. And whether it can be availed by mothers who have joined who have joined after availing 12 weeks of maternity leave. So those women employed who had already availed 12 weeks of maternity leave before enforcement, that is the first April 2017, they shall not be entitled to this extended benefit. So this is important for us, although this is not applicable right now, but this was a clarification given by the government. Now, the protection of women in case she's fired by the employer after learning her pregnancy. So under Section 12 of this Act, it is emphasized that any dismissal or discharge of a woman during pregnancy is unlawful, and the employer can be punished under the Section 21 of this Act. And whether the benefits of Act can be extended to employed women in unorganized sector. So we have to know this, that the Maternity Benefit Act is applicable to all mines, plantations, shops, and establishments and factories. So these could be either organized sector or unorganized, and they have provided benefit for all of these. Now, the updates which are important for us to note in this act is the center has notified and amended the rules to allow women government employees to take 180 days of maternity leave in case they have children through surrogacy. That is what is important for us. And therefore, the commissioning mother, the intending mother for the child born through surrogacy, will have this childcare leave, as well as the there is a option of paternity leave for the commissioning father according to the changes made in this rule. So this is the update regarding Maternity Benefit Act. Moving on to the implications of this act. An aware working mother. We note that there are many working mothers we are dealing with in our day-to-day practice, and they can get helped and benefited if they know how to continue work in breastfeeding. So this is an important pointer that we need to understand, that why WHO has been promoting these themes every 3-4 years, that they mention that let's make breastfeeding and work. So we have to note that it was given in 2015, it was given in 2023, and we are still talking about it. That means it makes this point very important, that for working women, breastfeeding needs to be supported and promoted with a lot of protection which is needed. So the more the mother gets supported, definitely for first 6 months, the baby's health is healthier, and the children would be more healthier. And community support is always better for promoting her work efficiency at workplace also. So these are the current scenario implications of Maternity Benefit Act that we should be aware of. Then coming on to IMS Act, it is the Infant Milk Substitutes, Feeding Bottles, and Infant Food Regulation of Production, Supply, and Distribution Act, which was brought in 1992, and it was amended in the year 2003. It is an Indian law which regulates the production, supply, and distribution of infant milk substitutes, feeding bottles, and infant foods. So this is a very important point for us to realize, that it is a law which gives us a goal that the infant foods are used properly. It aims to protect infant and young children from malnutrition and death by preventing commercial promotion of breastfeeding. And the IMS Act has come into effect since the year 1993. So it's been a long time that we have had this act, but still it is being underused. So we should all know that IMS Act prohibits us to get engaged in any advertising or promotion of infant milk substitutes, feeding bottles, or infant foods. Where this is an irony for us to know that many of our colleagues are prescribing infant milk formula, and they're prescribing that you should put the baby on bottle if the breastfeeding is not working. So it is very important for us to realize that this is an act which can take you to a legal action if reported against, because it provides unauthorized labeling of products, including complementary foods, using the images of mother and baby over the substitutes in order to make a promotion of their infant milk substitutes and the baby food products. It prohibits the use of educational material also, which could include advertisements for promoting infant milk substitutes, infant feeding bottles, or infant foods. We should not use any sponsorships, gifts, fellowships, and financial benefits for any of their associations. And use of terms like mother and children, or words which imply some superiority to breast milk, or maybe even similarity to breast milk, is something which is prohibited under this act. So the current scenario implications for this act tell us that awareness is the least amongst healthcare professionals, because many of us do not know about this act. Yeah.
9 minutes are already over. Yeah?
Okay.
Yeah.
So I'll just quickly run through this. So lack of skilled lactation care about breastfeeding benefits and community could be contributing to the breach in the act functioning. And healthcare professionals are not only responsible for compliance of this act, but they are supposed to report any violation of the act as well. So moving on to the next act is about Paternity Benefit Act, and we should briefly know about this act also, because even fathers are playing an important role in childcare. So they are at present receiving as paid 15-day paternity leave under the Central Employees All India and Central Civil Services rule. And these are the commissioning fathers, even for the babies who are born through surrogacy. Fathers of the children who are born through surrogacy are eligible to receive a 15 days paternity leave. Right. So there is a new rule which includes that the notice period of paternity leave is reduced from 15 weeks before the expected week of childbirth to 28 days. And this change is intended to help both employers and employees plan better and coordinate more smoothly during an important period. So that was a recent update. One more pointer I want to mention here is paternity leave is a paid leave. And if it is not taken in first 6 months, then it could be considered lapsed. Right. So implications are an important implication. Yeah. One thing I would want to mention for all of us is fathers who take leave for more than 2 weeks are more likely to be involved with their young children. And therefore, this can have a positive effect of gender equality in home and at work. And it may indicate shifts in relationships and perceptions of parenting roles and prevailing stereotypes. So, so the take home from this talk for all of us is there is more awareness which is required about breastfeeding protection laws, and it has to be propagated from the healthcare professionals to the parental community. There should be an informed approach and timely support which can build up a sustainable breastfeeding journey for the mother-baby diets. And open-ended discussions and updated plan of care needs to be included in daily practice of breastfeeding support in pediatric office or maybe outpatient as well as inpatient department. Thank you so much. These were the resources I took for this talk, and you can contact me for further.
Thank you, Dr. Surabhi. I request Jayan Shah sir to share his views on this presentation.
Nice presentation, Dr. Surabhi. Thank you. I would like to say a few words about the IMS Act, because the details have been given very nicely by Dr. Surabhi. But the problem is most of us really do not give that much importance to this IMS Act. Although some of them know, some even don't know about it, but it is not taken very seriously. So before you accept, say, any gift from any pharma company, at least you have to see that whether it is a company which comes under IMS Act. Secondly, if there is any program and you are invited as a delegate or a faculty, you have to first see whether it is the sponsor is one of the IMS companies. If it is, then you have to say no to that. So this is extremely important, and for this I have prepared one IMS oath. And in our IYCF chapter, all webinars, we end the webinar with that IMS oath, where we say that I will not accept any gift, vagara, vagara, all those things are there in that. Another point is, this IMS Act came from the international code. So WHO and the international faculty, they have a similar type of like IMS Act, but that is called as a code, and that is the guideline. And every country has to see whether they want to accept it or not. And based on that code, India has this IMS Act, which is made a law. So IMS Act and the international code are slightly different, although most of the things are similar. And one more thing is paternity leave. We say it is for 15 days, although there is now some change now coming up. But 15 days, why 15 days? So we have to understand that the first 15 days are the most important for establishment of lactation. If there is no problem and if the lactation is well established in the first 2 weeks, then generally the breastfeeding journey is smooth. But most of the problems occur in the first 2 weeks, and that too in the first week, and that too in the first 2-3 days, 4 days. So we have to be very careful that that time the mother needs support not only from the healthcare professionals, from the family members, the husband, everybody. So that is why it is a good thing that paternity leave is also sanctioned, and the father also understands the importance. Father also gives the good support to uh, the baby's mother, and everything is together. So it is a breastfeeding journey. It should be a very pleasant one for everybody in the family and the baby. So that is the purpose of this leave. So that's what I want to say. Thank you.
Thank you, sir. Mangala ma'am, do you want to add something to it?
Yeah, I mean, a good presentation, about this maternity leave, total 6 months, but some mothers, take even before delivery 2 months or something like that. And then they get only 4 months after the delivery because all together. So it is important that before delivery, if they take any leave, they should take it under some other category, and that should not be under maternity leave, so that they stay with the baby longer, because it longer they stay full time with the baby, there is a more chances that the exclusive breastfeeding will continue for 6 months, and even the longer the continuation of the breastfeeding. So that is very important. Another thing about this IMS Act, Dr. Jain sir already has said, many health professionals are still not aware, or they break it very easily. So, not taking any sponsorships is so important. Like in breastfeeding week, typically they come and they say, we want to celebrate the breastfeeding week and let us make some program. And we are talking only on breastfeeding, they say. Now, when the industry who is making money on that product, why they want to promote the breastfeeding? And then they order nice the pizza and coke and all this goes routinely all around. So it is very important that we should not take any sponsorships, and or we should not take even lunches or food even from them, or if they are organizing such activities, we try to stop them. That is also important. So the IMS Act, because they are always there to promote their product. They are not there for the health of our baby. They are there to make the money. That is very, very important. About the fourth lecture, again, I had a problem with my laptop. So there was one point that there is an increased productivity, when the working mother continues to breastfeed, or when she expresses even at work, and the next day the caretaker gives that milk to the baby. So why her productivity is increased? Because she is happy, mentally, even she is at work, still her milk the baby is getting. So her work output is better. And in addition, baby is less ill because baby is on again on the breast milk. So these are the important points. The boss also needs to know that if they give the facility, it is better for the even the work output of the mother. I think these are the points I wanted to emphasize. But generally, good presentations, good efforts from every one of them. And I'm sure they have learned something new about the breastfeeding. Do they agree or not?
Yes, yes, surely.
Yes.
Very
Just
nice,
one
nice.
point I had forgotten to make
Hmm.
is IMS companies. You have to see that the sister concerns of these IMS companies also come under IMS. But sometimes you see that there is one what you call a
Department.
one department is say producing formula, and they say that, but we are from the different thing. We are from the vaccines, for example. But if the company is the same, the money is the same, so ultimately you cannot take sponsorship from that vaccine concern also. This is one important point. And IAP has made a list of the companies which come under IMS Act. It is there on the website. But we have to be careful that, because every few days some new company will be having will come under IMS Act, but it may not be updated in that immediately. So we have to see every time whether this sponsor is under IMS Act or not.
Yes. Thank you, sir. Thank you,
Thank you,
ma'am.
sir. Thank you, ma'am, for your words of wisdom. Let us quickly proceed towards the vote of thanks now. It gives me immense pleasure to deliver this vote of thanks on behalf of the organizing team. I would like to extend my gratitude towards Central IP President Dr. Basavaraja sir, Maha IP President Dr. Ram Gopal Chezara sir, Honorary Secretary General of Maha IP Dr. Amol Pawar sir, Dr. Bhavesh Mithya sir, the scientific convener, Dr. Manjusha Sherkar ma'am, Chairperson Women's Committee Maha IAP. Thank you ma'am for giving me the opportunity. Dr. Amruta Bhaviskar ma'am, Convener Maha IAP Women's Committee. Dr. Grivita Raikar ma'am, Co-Chairperson Women's Committee Maha IAP. A big thank you to our experts Mangala Vani ma'am and Dr. Jayan Shah sir for sparing their valuable time and guiding us throughout this program and making this program a huge success. You two were outstanding, ma'am and sir. Thank you, Dr. Sanjay Gosavi sir, our MMC observer.
तुला 1000 रुपये आज सुरू करतो. Okay.
I congratulate and thank all our speakers, Dr. Anuradha ma'am, Dr. Shabana ma'am, Dr. Kavish Mehta, Dr. Swapnil Giri, Dr. Surbhi, and of course my co-moderator, Dr. Anju Kadu ma'am. I also thank Pallavi Dharmadhikari ma'am for her digital support, and a big thank you to all our delegates for their patient listening. Thank you so much, and good night everyone.
Thank you, Dr. Prachi also. You and Dr. Anju Kadu had a very good, excellent moderation. Thank you.
Thank you, ma'am.
Thank you, sir. Thank you, ma'am.
Thank you.
Yes,
Thank
sir.
you very
Thank
much.
you.
Thank you, Jain sir. Thank you, Mangala
Thank
ma'am.
you,
Thank you,
Amol.
Manju
Yes.
ma'am.
Dr. Amol sir.
Thank you, Amol sir. You are
Was missing.
traveling.
All
Yes, yes.
speakers. Yes, thank you.
Chalo. Amol sir is
Yes.
rock support for everything.
पोचलो दादरला.